morning, Facebook. Good morning, Enlace. Thank you for joining us today. We have a special bonus presentation for you today. But before we get into that, I'm going to turn it over to Rita Dominguez, who is our Health Committee Chair, to get us started off with our mission and vision of Enlace. Oh, you're muted, Rita.
Sorry. Good morning, everyone. Thank you for joining us today. Again, my name is Rita Dominguez with Atrium Health, and I'm the chair of the Health Committee with Enlace. Thank you for joining us today. I'll be glad to read our mission and vision for Enlace, and that is to develop and strengthen connections through information, collaboration, and partnership with organizations and leaders who serve the Latinx community. Our vision is to enhance social capital within the Latinx community in the Charlotte metro area. Thank you, and hope you enjoy this wonderful presentation today. Thank you.
Thank you, Rita. We have some special guests with us today. I'd like to welcome back to Enlace Dr. Montoya Rodriguez, who is with University of North Carolina at Charlotte, who is a professor of sociology and social work. And also we have Jennifer Ramsey, who is a project coordinator for their Caregiver TLC program. So I would like to introduce them, and if you could just give us a little bit of background about your professional experience in the work that you do.
My name is Julian Montoya Rodriguez, and I am a professor of sociology and gerontology, and I have an appointment at the University of North Carolina in Charlotte during the past 7 years. I was the director of the gerontology program, and now I just focus on my work on family caregivers and how to help them. We are here today because we have developed this program that normally is offered face-to-face over Zoom now, and we would like to offer that to any caregiver in the state. So with me is also Jennifer Ramsey. Dr. Ramsey is a developmental psychologist. Maybe you can also introduce yourself a little bit.
Sure, I'm a lifespan developmental psychologist. I've been working with Dr. Montoya Rodriguez on several projects aimed at improving health and well-being outcomes and access to services for older adults in the greater Charlotte area. And as he mentioned, based on the needs we've observed, there's a strong need for supports for caregivers to those of older adults. So this is a really innovative program to help caregivers.
Thank you. Anyone who is watching on Facebook, if you think of any questions for our presenters throughout the presentation, just type those in the Facebook chat and we'll get those to our presenters at the end of the presentation. And without further ado, let's get started. Go ahead and pull up your presentation and we'll get started. Thank you.
One of the studies that we have completed during the past years here in Charlotte is the assessment of older adults. And that study included a sample of family caregivers. So we talked to about 130 caregivers in Charlotte and the county, and we asked them questions about their health, their mental health, their programs and services that they use, in a series of things as to make to have sort of a profile of what they need and what they are doing now. So I'm going to give you like a brief summary of the study, the findings, and then that will justify why we are doing now this program to support caregivers. Most of the caregivers they completed some level of education at the level of bachelor's or graduate level, and their age is about 62 years. They are not really too old. Most of them are probably the children of the older adults, and they are still working, some of them, which may present some problems. The income is on average between $45,000 and $59,000 for the caregivers. And the relationship is most of them It's just divided between the parents, the spouses, and the adult children. In the sample, 2/3 of the care recipients live with the caregivers. They're in the same place, especially those who have dementia and they have more need. They just need 24-hour supervision. Now, how long can you be expected to be a caregiver? Most of them are just about from 1 to 5 years, but there is a big chunk of caregivers, about another 30%, that will be more than that. And that's a lot of years for a person who is just dedicated to the care of somebody else. Is the caregiving activity interfering with your job responsibility? Not for all of them, but for a minority of 30%, they do have to do adjustments and be more flexible at work, which is another thing that has to happen in consulting with the employers. So who are the person they are taking care? They are just providing care. There are people who actually have chronic conditions, at least 3 of them. And this is the number of percentage of people that responded, what kind of conditions they are actually experiencing. So they care for people with hypertension, arthritis. Many of them will be African Americans, especially the hypertension condition. And then half of the sample said that they are caring for somebody with memory loss, dementia, Alzheimer's. So that's 50% of those. So that's a big chunk of caregivers. And you will see why I stress that, because those dementia caregivers do suffer the most in their mental health and the burden. We have depression, about 34%, and that's mostly for Caucasians, white caregivers. And we also have diabetes, which is 31%, and that condition affects mostly 2 Latinos. We didn't have enough individuals from each group in this sample, but this is very much in agreement with the general information that we have from caregivers in the population. The care planning information is also very interesting. Most of the caregivers report that their loved one has a legal guardian or power of appointment for health-related issues, for medications and financial issues, also to manage their estates. That means that about 40% they don't, which is a big, a large number of older adults. Caregivers also report that their care recipient has an advanced medical or psychiatric directive, 50% of them only, and durable powers of attorney, 64%, and those with last will and testament, 62%, which is, again, many people do not have this, which may be necessary, especially as you approach that situation where you are losing control of who you are and you cannot make decisions. So there has to be some action to really deliver this information to the communities. In terms of abuse, the caregivers are sort of afraid that somebody is going to take advantage of their care recipients if they are in contact with them. And that's, especially for situations where there is neglect and also other type of abuse. So these are the percentages for the abuse. They fear most the neglect of their relative, and also that they will be forced to do things that they don't like to do it, or take advantage on the financial issue with the money and other situations. So that's a big concern for those caregivers. In terms of the services that they are using, most caregivers report that they go to the doctor. Like in these slides, you can see everybody goes to the doctor, but then very few go to the specialist. 34% go to the emergency room, which is not a good idea, at the hospital visit. very expensive. But they don't really use the services that are in the community. Group meals, senior centers, support groups, the respite adult daycare centers, counseling. We don't really have developed this network of support for them. In terms of using paid services, the percentages are very low. Very few people, about 30%, use some professional providing home maker services or home health services, non-medical personal care, especially those who need more like ADL attention, and also respite services. But these are very small sort of percentages for people who can afford really some additional services. If now we focus on the comparison between the dementia caregivers and the non-dementia caregivers, this is what you can see here in this graph. So if you have dementia, you are in the red color. I mean, in the red color, you're a caregiver providing care to someone with Alzheimer's or dementia, and you're in the blue is no. So do you have informal available respite services? So if you are taking care of somebody with dementia, you do not have the same level of use of respite than the other ones that probably have less burden and less need for that. So that's something that calls for attention to dementia caregivers in particular within the caregivers in general. The care that they are providing here, again, the red color will be dementia caregivers. So the number of chronic conditions, they care for people with more chronic conditions than the non-dementia caregivers. That's another argument to support dementia caregivers first. So in terms of support that they get from other people, it turns out that dementia caregivers do not get as much support as those who are caring for people with other chronic conditions. And that's another argument to support the dementia caregivers. On the other hand, they use more respite, adult daycare services, and a little bit more of paid services here. In terms of ADLs or assistance that they provide to the care recipients, you can see here consistently for each one of the tasks, dressing, this is personal ADLs, instrumental activities like laundry, house cleaning, medical issues, shopping, everything. The dementia caregivers are, providing, or they do have more need than the non-dementia care recipients. So that's another argument to support the dementia caregivers. And so who needs information? The dementia caregivers, because this really is something that they are not prepared for. And when they are in the process of providing the care, they know it's going to be for a long time. So they are asking for information from the community services, from the nonprofit organizations, on information on all types. So they need information, they are seeking information. And then we look just to finish this section on a series of outcomes. What is the outcomes of the caregivers given all these things that they are doing? And this is a list of outcomes here. One of them is the question about, would you place your relative in a nursing facility? Now, I don't know you, but nobody wants to go into a nursing facility. So especially among the Latinos, that will be the last thing that we will do. But if you are providing care for a dementia caregiver, care recipients, they are more likely to place you in a facility than the non-dementia caregivers, 252 to 172 in both conditions. When you are okay, as you are today, or if your health gets worse. So meaning that the intention to place somebody into a facility is higher for those who are providing care for dementia relatives. So it's another sort of a sign that something is going on and they have a greater need. When we look at depression and stress, we have information for non-caregivers. The level of depression, the mean was 15 points, from 0 to 40. And when we look at caregivers, the depression went up to 17.3, which is statistically significant, meaning if you are a family caregiver in general, you have stress. And if you are a family caregiver or somebody with dementia, you have a much higher level of depression than the other groups, which is another good argument to focus on that. On level of stress, the same thing. Non-caregivers, 2.5 from 1 to 10. On family caregivers, 5.5, which is moderate from 1 to 10. And for dementia, higher, 6.2 in that range. So you can see the evidence that we need to support, in particular, caregivers, dementia caregivers, if we need to start with a program to support them. On the other outcomes that we look at, in terms of depression, we already look at that in terms of strain, more strain for dementia caregivers in comparison to the others, more problem with perceived stress, more problem with burden, and more problem with the stigma, because the dementia has that kind of connotation that people don't want anybody to know about it because of the possible values or sort of perceptions that they have, ideas about dementia. So this is sort of a summary characteristics of the profile of the caregivers in Charlotte. On average, 62 years, most of them, 70% are female. Income is pretty much adequate to their needs, only for 70% of them. Work status, yes, 55 said that they have to make a change in their working kind of commitment, and maybe less hours, maybe to retire. Caregiver health problems, physical and mental problems, 56% the caregivers said that they have trouble mentally or physically. Nursing home placement, we saw this an intention pretty high, 37% said that they are thinking about a facility, which, like I said, nobody wants to go there. Caring for people with dementia, provide care to dementia family and friends, 49%. And then these are the outcomes for the stress, self-reported stress, and it's higher for caregivers. And when we asked them if they got any help from community organizations, 70% said yes. So there's a 30% of caregivers out there who don't get any help from community organizations. So this brings us to the program that I want to talk to you about, which is this Caregiver Thrive Learning Connect. This program was developed by colleagues at the university in Stanford in California during the 90s, and it has been examined in many different studies, and we have plenty of evidence that really works in reducing the level of stress, depression, burden, all the mental health problems that experience the caregivers. And the program has been actually offered in multiple languages when it's delivered face-to-face. So what we are doing now, because of the pandemic, is offering the program through Zoom sessions, where we train facilitators, local facilitators, social workers, and professionals to deliver the topics of the intervention in small groups of caregivers. We do this, the caregivers don't need to leave their home. You can join with your phone or your computer, and you can actually meet the other caregivers in the group. If you go to our website, I'm going to show you, this is the website here, Caregiver TLC.org, but I'm going to actually share the website with you, we just put it out there. We have started already the workshops. This is the main page. And what you have here is an introduction to the program. You can see down here what is the intention, the main goal of the TLC program, and is directed to those who are providing care on a regular basis, at least for 4 hours a week, to an older adult with a chronic condition or a memory loss or a dementia problem. There is also a section for caregivers in general, and we we plan to actually invite everybody who attends the sessions to join this community online virtually of caregivers so that they can talk to each other and share their concerns and learn about resources and so on and so forth. So this will be a website where we will add more information. Those who want to attend the workshop, they can register for the sessions here, which I'm going to show you on the section for, I can send you, I can tell you about the program a little bit. This is the description of the topics of the sessions. So every workshop has 6 sessions. You will be meeting for about 2 hours once a week with the other caregivers and the facilitator. And this will be the topics that will help you to sort of regain a little more control of yourself and learn strategies to overcome the negativity of your condition and focus on positive outcomes. So the first one is, let's talk about stress and what you can do about that. Second one is, you may be even feeling depressed. Depression is the #1 malady of the world today. So across the board. So you normally, especially when you start to experience that your relative doesn't know you anymore, depression is something that you need to be aware of. And then how you are resilient, what kind of strategy you can use to actually still looking forward to to improve the quality of life of your family and the loved ones. How do you actually take care of yourself? How do you cope with your frustration if it happens? And how do you make a plan for a better caregiving relationship and caregiving experience? Some caregivers do report that they enjoy being a caregiver because they like that situation where they take care of their loved ones. So you can also, in this website, go to the About, which is about us, and you can see a little bit about the history of the program here. The Optimal Aging Center is the center in California who is doing the training for the facilitators, and they are the ones who developed the program. And they are working already with 4 facilitators now. We have started the workshops. We will be offering the workshops for the rest of the year and probably next year to the end. So we are here to offer this. We have the support of actually Southminster, our local organization that is interested in support family caregivers. And they have provided the resources that we need to offer this completely free. It's a program that is anybody can access. You don't have to pay for anything. You are actually welcome to take advantage of this program and participate with many other caregivers. This is the research team. Dr. Gallagher Thompson, Dolores Gallagher Thompson, she is the PI of the developer of the program, the original program, along with Larry Johnson, who is her husband actually. And then you can see the rest faces. That's Jennifer, who is joining us today. And we have other colleagues from the UNCC, Dr. Kendra Jason, and the core director of the Optimal Aging Center, which is Dr. Ann Bilbray. She's also on the helping with the training of the facilitators. We have another person from the Department of Public Health here, in Charlotte, and she's a biostatistician. She will help us with the methodology. And Mr. Bruno Kajiyama is the CEO of the Photosig, who has developed this beautiful website for us to actually deliver the program, because every activity in the program is going to happen through this website. So we have different sections, and everything is just going to be no paper at all. So what is what we are looking for? So just going back to my previous presentation here, this is what we are looking. So the main thing is that who is a caregiver? So if you provide a range of assistance to an adult, a relative, a partner, a friend, or neighbor with a chronic or disabling condition for about 4 hours a week. So we are going to ask you this question so that if you want to participate, you need to qualify for that. So this is one of the requirements that we are seeking. It's just if you are doing any caregiving, you are welcome to take advantage of this. You need to be 18 years of age or older, and you need to be able to attend weekly 2-hour Zoom sessions. Now, if you are not familiar with Zoom, we have graduate students here and undergrad students who will be able to teach you how to use Zoom and the technology. And if you have any problem, they will be on call to just make sure that you know how to manage this technology, and that's not a barrier for you to participate. It's not complicated, and you can do it with your phone, which I know many people just do almost everything on that. So we provide also that training for people who want to participate and they don't have much sort of use of the Zoom video conference like this one we are actually on. So also, if you wanted to find out about other caregivers and maybe other community of support, and so you are welcome, and you will be able to do that after you complete your attendance of the sessions. You also need to have an email address, because that is what we will use for you to be able to connect to the Zoom sessions. So basically, this is the message. This is a program that is evidence-based. We know it works. It usually works face-to-face and in many different groups, and it has tried all over the world. Now we are just developing the online version. We think that it will work exactly the same, even better, because less logistical problems, but we need to test it. So we are going to offer this program during this time to make sure that the program is delivering the same results to help the caregivers. But it's not a program that somebody thought overnight and it's just going to tell you, take this. It's something that we know it works in many other contexts and situations. The original program is listed on the National Institute of Health as a program of recognition and evidence-based. So you can also check the program over there. So the website, I gave to you the website for the program, and you can always send me an email if you have any questions. This is my office number here. I'm here in Charlotte. I'm based at the university, and I don't know if Jennifer would like to add any information that I am not able to tell you. And if you have any questions, I'll be happy to answer. We will be happy.
I think you covered everything very well. The only thing I would add is, given that many caregivers don't have a lot of time in their day, right? And it's difficult for them to leave the house. The fact that this program is virtual and online may be a benefit to them. So again, if you're in the Charlotte area, even not in the Charlotte area, everything is online. It's the opportunity to connect with other caregivers, learn new skills, learn new ways to manage stress and depression. And you can do that from the comfort of your home. So I think it's a very innovative program. And again, backed by years and years of research.
Thank you. Oh, I'm so grateful that y'all have joined us today to bring awareness to dementia and caregivers. I think this is a very important topic, and I love spreading awareness about it. And thank you for all the research that you continue to do on this topic. And I have a question. The research that you presented today, was this collected pre-COVID? And we've heard that COVID has increased burnout and stress and may have even affected the health of those with dementia, and their health has declined since COVID. So this is what we've heard, but I don't know, is that reflected in the research that you've presented, or is this research pre-COVID and you expect these your research to be affected by that?
So the MEC60 was collected, the data was collected in 2018-19, that was before COVID. And you are right, the research that we have now indicates that people are having more mental health issues because of the virus and the fear of it. And in fact, we were collecting data on affordable housing for older adults at the retreat here and also at Edwin Towers downtown. And the first round of data was right before COVID hit. And the second round was just in the middle of it, just after COVID. And yeah, we saw very different levels of stress on the second follow-up because of the COVID. That was, I'm talking about March of last year. So nobody thought that this will last this long. And so I'm pretty sure that today we are still having same sort of high levels of distress for caregivers. One of the critical issues is the gap, the Medicare gap that we have. We have more people that needs help because people live longer and they do have chronic conditions. And we have fewer people to take care of them because we have less children, basically. Less people are available to do that. So we have to be creative in delivering support to those caregivers so we can actually contribute to the care of older adults.
Mm-hmm.
There's like a gap between the need and who is the resources available to provide the care.
Mm-hmm. Yeah. Great information. I have a question myself as a caregiver. I mean, I understand and I am so grateful for this program, and I wish I knew about it, but anyway, and I'm the only caregiver basically for my mom, and she lives with me, and it kind of reflects a little bit what the topics are and the support that caregivers need. So can you elaborate a little bit more about an example of the tools that are provided for the caregivers? I know you mentioned a couple of the sessions and their life, and what kind of tools are they provided for the caregivers?
So for every session, there are some exercises and specific techniques that they are going to rehearse, and then during the week they are also going to do some homework on that. Any focus on things from relaxation to, to sort of get the stress of you, and also how to communicate with professionals and with others in an effective way. You don't have to yell to people to get to where you want to go. So you need to learn how to ask for help because you need help, and you need to recognize that. And so that is also encouraged to overcome some of. But the underlying sort of conceptual ground of this program is a behavioral program, meaning cognitive behavioral program, meaning positive thinking is the way for you to take control of your life and get rid of the negative experiences and the anger emotions, the negative emotions that go associated with that. So teaching you how to really focus on solving problems in the positive parts of life, and especially in that difficult situation where you're caring for somebody and you know that that person is just getting worse every day and not any better. So I think that's very powerful. So caregivers also do like a diary, like a plan of action, set goals, what we can accomplish. The program has more than 6 sessions. We just chose 6 for the profile of the caregivers here. But if somebody wants to really be more specific, let's say about, I'm taking care of a relative with dementia and he's becoming disruptive because her behavior is just aggressive. What do I do? So we have modules to help you to manage the behavioral problems that you may face at home in a positive way. And so it's flexible in terms you can choose some of the topics that we are not going to cover in the sessions, but as you know, the strategy to be successful, you can apply that to different parts of your emotions and your situation. And the website will have resources to cover additional topics that you may be interested in. We will listen to caregivers in the community of caregivers that will tell us, we would like to talk more about resilience and how do I come back, and what kind of strategies do you recommend? And there are plenty of work on that. So that's the foundation. It's just a behavioral program, basically cognitive behavioral. Change your thoughts to change your behavior.
Would you say it is more like a training workshop or more like a support group type, or kind of a hybrid between support group and workshop training?
The program can be offered one-to-one, but the fact that we are bringing the group also, makes the program like a support group, because you are going to hear from other people like you, their experiences, you are going to learn from them, and then you are going to actually feel emotionally tied to them, and that's going to be a support. But we will offer mostly, it's not therapy, it's just training. It's just training.
Okay. Is there a deadline for signing up for these sessions?
So Jennifer, why don't you
Sure.
help us there?
Great question. So there's no deadline to sign up. The way this process works is it's based on the caregiver's availability. So you just go to our website, you fill out that short registration survey, tell us a little bit about what your availability looks like. And once we have a group that meets your availability, you can start. Again, completely based on caregiver availability. So if you're only available on weekends, we have sessions that meet on weekends. If you're only available on Mondays, we can have sessions and groups that meet on Mondays.
So we are running a couple of workshops now, and we will be, as long as we have caregivers interested, we will continue to the end of next year.
Mm-hmm.
And I think you mentioned something about follow-ups. Is there a follow-up, a post survey for the caregivers after they take the training, and how often are there follow-up and giving support?
So there are two things. Yes, we do a pre and a post assessment of the caregivers because we want to know if there's any change in the main issues of the outcomes, the mental health issues. But then we offer the caregivers to continue interacting with the other caregivers in this community, virtual community of caregivers. And in there we will have information and topics to discuss, and it's more like a place where the participants are sort of the actors. They decide what they want to do, and it will be it won't be a support group, but it will be a community that really share their experiences. And if I found this resource, this program that really is important, and I share that with the group, somebody maybe actually benefit from that.
Have you received, what's the type of feedback that you've received so far from caregivers? Has it been mainly positive? Have you had any success stories or touching feedback that you've received?
So we train the facilitators, and they are very motivated, and they are so committed. And so that's just an indication of how these people who are professionals, they're also committed. We are not really offering them any monetary kind of incentives. They just want to do it because they want to help the caregivers, and this is a good way to learn and keep the capacity here in town because they are going to be living here with us. And then we will know from the groups as they complete their workshops. Yes, caregivers that we talk to, they call us like, very emotionally invested in being able to be part of the program because they think this is something that is missing for them. But we will have testimonials as we complete the sessions, and we will put that on the website based on the experience in the other programs. We expect that most of the people are going to like it. If you come to the program and you decide it's not for you, there's no problem. You just stop coming, and that's also, some people may have a different idea what kind of content, what kind of program is this. But all the information will be disclosed and on the website for people to know, evaluate. And if you don't have any mental health issues, probably the program is not going to do much for you. It's just for people who are just going through some kind of behavioral work, and that is so that's another thing. But I would say for the most part, I'm really impressed. I don't know, Jennifer may have. She deals with everybody else too, so.
So again, we've just started offering these sessions, but so far the caregivers that are participating seem very engaged. They are excited every week when I send them the link to the Zoom meetings. Thank you, I'm looking forward to this session. So early on, again, we don't have any data yet, but as Dr. Montoya Rodriguez says, everyone is motivated, the facilitators are motivated, the caregivers seem motivated and interested. And as you saw from that presentation on resources for caregivers, there aren't many. So this is really something that caregivers want and they're looking forward to. And the more people we can offer this program to, the better. So as it stands, caregivers for right now, at the very beginning, we're getting really good feedback, and I expect that to continue.
The other point that I would like to make is that we have been talking to many groups in the city and in North Carolina, the memory centers, the Atrium Health, geriatrics, and neurologists. And all these organizations are really happy that we are able to offer this program. And they are also disseminating the information, the Alzheimer's Association, the Dementia Friendly Coalition, and so on. So, I'm really confident that we will be able to reach out to those caregivers. The most difficult task is to reach out to the most vulnerable and needy caregivers, and those will be the African Americans and the Latinos in particular. And unfortunately, if you're Latino, unless you speak English, and which chances are, if you are a caregiver, you are going to be able to speak in English completely. You can participate, but for the Spanish speaking, we have other resources that we will put online, and eventually we will also offer it in Spanish.
Just a quick question on the different modules that you cover. Is there a section that covers grief? And I'm assuming yes, but I don't know if it is. Well, on the spiritual component, I saw a spiritual component there.
The team is working on that concept of grief, but it is such a different situation, the loss, and even hospice caregivers who are taking care of hospice patients, we thought that we would have to develop a different modules, and so that may not the best fit. The basic ideas, everybody will understand that. I need to really take care of myself, focus on positive things and experiences and improving this relationship. But on some of from the psychological, Jennifer is a psychological developmental psychologist, and it's sort of slightly different. And so we are working on those modules because we have been asked by the hospice, Charlotte Hospital organization to develop something for them. And so that's where we are now working.
Thank you.
And is your program for those with any chronic condition and any disability, or would you rather focus more on dementia?
We are taking, we are thinking of everybody. This program is good for any caregiver providing care to people with any chronic condition, including dementia. It's just fine. It will be fine. Yes.
Okay, perfect. I don't see any questions on Facebook, but you provided your email, so I'm sure if anyone thinks of any later, they can get in contact with you. Rita, did you have any other follow-up questions?
Not at the moment, but thank you. We really appreciate your time and being with us and presenting this wonderful, wonderful resource for our community.
Thank you
Yes,
to you. Yes.
Thank you. It's always a pleasure to have you at Enlace, and we look forward to seeing where your research takes you and where this project goes, because I know it's just in its infancy. So I look forward to seeing where this goes. So thank you for being here, and we hope to have you back.
Thank you, Alicia. Bye-bye.
Bye-bye. Thank you.